Alpha-1 antitrypsin deficiency is a genetic disorder in which a protein called alpha-1 antitrypsin is defective or absent, and this causes lung and liver disease. Trypsins are a type of protease, which is an enzyme that can break down other proteins. So this antitrypsin protein is a protease inhibitor and inactivates trypsins, thereby preventing protein breakdown. The alpha-1 is just a letter and number combination given before its role was known. Now, in the lungs, if we zoom in on a tiny alveolus, which is where gas exchange happens, when there's some sort of infection or other cause of inflammation, immune cells like neutrophils arrive on the scene. Neutrophils make an enzyme called neutrophil elastase, a protease capable of breaking down elastin, which is an extracellular matrix protein that gives elasticity and strength to lung tissues. So while these little guys can help fight off infection by breaking down proteins of the bacteria, it can also go on to break down that precious elastin. Fortunately, the liver makes alpha-1 antitrypsin, which gets released into the blood and sent to the lungs, where it inhibits neutrophil elastase, just like it inhibits trypsin, inactivating it before it can break down the elastin. Without alpha-1 antitrypsin, the opposite happens. Neutrophil elastase goes unchecked, and it damages the walls of the alveolus, and without that elastin, the alveolus loses its elasticity and structural integrity. Zooming out a bit and looking at the acinus, which is a bunch of alveoli, it just turns into one big cavity. This destruction and enlargement of the air spaces is called emphysema. It turns out that emphysema can develop in a couple different ways, and alpha-1 antitrypsin deficiency causes pan-acinar emphysema, meaning the whole acinus is affected, and it also tends to affect the lungs' lower lobes the most. Another effect of unchecked inflammation in alpha-1 antitrypsin deficiency is chronic bronchitis, resulting from increased mucus production and narrowing of the airways. So alpha-1 antitrypsin deficiency can lead to both emphysema and chronic bronchitis, which are the two types of chronic obstructive pulmonary disease, or COPD. Another more common cause of COPD is smoking, and if someone with alpha-1 antitrypsin deficiency also smokes, they tend to get an earlier onset of COPD than they would have otherwise, an example of a gene-environment interaction. Now, the gene that encodes alpha-1 antitrypsin protein is called SERPINA1, which stands for serpin peptidase inhibitor clade A member 1. While some mutations in SERPINA1 completely delete the gene's message, meaning there's no alpha-1 antitrypsin protein, others, like the most common mutation called PiZ, results in a misfolded alpha-1 antitrypsin protein being made. Misfolded alpha-1 antitrypsin can aggregate and get stuck in the endoplasmic reticulum of the liver hepatocytes where it's made, causing some of those cells to die. Now, each wild type or normal copy of the alpha-1 antitrypsin gene, termed M, contributes 50% of normal alpha-1 antitrypsin activity, meaning it's co-dominant, and two normal copies gets you 100% normal activity, which just means that there's a normal amount of alpha-1 antitrypsin in the blood. If instead they had one normal copy and one mutant copy, Z, abbreviated PIMZ, the mutated gene only contributes about 10% of normal amounts. So these individuals only have about 60% the normal levels in their blood, which is actually usually enough to protect the lungs in non-smokers. If both copies of the gene were mutant Z copies though, then typically there's only about 15 to 20% of normal levels, which results in alpha-1 antitrypsin deficiency. Since you need both mutant copies for the disease, this makes alpha-1 antitrypsin deficiency a recessive disease. Symptoms of alpha-1 antitrypsin deficiency typically involve the lungs and the liver. The changes in the lungs that cause chronic obstructive pulmonary disease result in shortness of breath, as well as wheezing, mucus production, and chronic cough. The death of liver cells can ultimately lead to cirrhosis, a process in which normal liver tissue is replaced with scar tissue. Cirrhosis can lead to a number of complications, including an inability to make coagulation factors, difficulty with detoxification leading to a buildup of waste products that can cause hepatic encephalopathy, and an increase in the risk of a type of liver cancer called hepatocellular carcinoma. Although cirrhosis usually affects adults, even newborns can have complications like jaundice, or buildup of bilirubin in the blood because of poor excretion by the liver. If, though, somebody has the mutant SERPINA1 gene that results in no alpha-1 antitrypsin protein, as opposed to the misfolded ones that get stuck, then they typically don't have any liver disease. Diagnosis of alpha-1 antitrypsin deficiency often starts with a chest X-ray or chest CT scan to look for hyperinflated lungs or evidence of damaged lung tissue. In addition, pulmonary function testing can be used to measure how quickly air exits the lungs, which can be slower than normal. The level of alpha-1 antitrypsin in the blood can also be measured. Cirrhosis caused by misfolded alpha-1 antitrypsin can be diagnosed with a liver biopsy. Liver cells are treated with a combination of two reagents called periodic acid and Schiff, or PAS. This test stains glycoproteins like alpha-1 antitrypsin a pink color. The tissue is also exposed to diastase, which is an enzyme that normally destroys alpha-1 antitrypsin. But since alpha-1 antitrypsin's stuck and hidden away in the endoplasmic reticulum, diastase can't get to it and destroy it. And so we say that it's diastase resistant. So we say that they be periodic acid and Schiff positive, or PAS positive, as well as diastase resistant. In terms of treatment, augmentation therapy is where you replace alpha-1 antitrypsin in the blood. Although this doesn't cure the disease, so other therapies for chronic obstructive pulmonary disease like supplemental oxygen are often needed as well. Giving someone the deficient protein in the blood doesn't fix the liver problems, since these are caused by defective alpha-1 antitrypsin building up in the hepatocytes. So standard treatments for cirrhosis are often needed, like using lactulose to prevent hepatic encephalopathy. Alright, as a quick recap. In alpha-1 antitrypsin deficiency, the alveoli of the lungs are damaged by neutrophil elastase, since there's no alpha-1 antitrypsin to counter it. And this causes chronic obstructive pulmonary disease. Also in the liver, misfolded alpha-1 antitrypsin builds up, which kills the hepatocytes and leads to cirrhosis.